Yeah, thank you for the introduction. I'm a PhD student working at the Mouse Imaging Center at SickKids, and for this presentation, I'll be talking about how chemotherapy affects brain development and immune response in young mice. So I'm just going to put up the laser pointer here. All right, so why chemotherapy? To put chemotherapy into context, we have acute lymphoblastic leukemia, or ALL, which is the most common cancer among children. Fortunately, with chemotherapy, we can achieve greater than 90% 5-year survival rates. But as we can imagine, if you give children intense chemotherapy treatment at such a young age, there tends to be late side effects, such as cognitive impairments. And this might include slower processing speeds, inability to focus, or poor working memory, all of which decreases their quality of life. To demonstrate this decrease in quality of life, our lab published a study to follow up with ALL cancer survivors years after treatment to see how they were doing. So here I'm showing you results from a survey conducted by parents to gauge their child's school performance. And if we can look at this upper bin 80 to 100, we see that the survivors in blue don't do as well in school as their developing counterparts in orange. In another study, the same cohort of children were scanned using MRI. And as I found that there was about a 6% decrease in total white and gray matter volumes for these survivors relative to the controls. Thus, we see both quality of life and neurological changes in these cancer survivors, and these deficits are usually attributed to chemotherapy. So treatment of ALL consists of 2 to 3 years of chemotherapy, which can get quite complicated as there's a variety of drugs at different stages. And just to illustrate this with an example, here's a sample regimen. So here I have the stage, and underneath it, the drugs that you might take. So within the first month, you undergo the remission induction stage, where you might be administered vincristine, L-asparginase, dexamethasone, and then so on and so forth with all of these other stages. And because this treatment is so complex, it's difficult to know where to even begin when it comes to figuring what is causing these deficits. And so one solution is to investigate the effect of each individual drug. And this is what a postdoc in our lab did a few years back. So she took each drug representative of a class of chemotherapy agent in the regimen and gave it to mice to screen for brain volume changes weeks after treatment. And mice are particularly advantageous here because of their accelerated development trajectory, meaning we could observe structural brain changes in a matter of weeks, whereas in humans, it might take months to years for us to observe these changes. So here are the neuroanatomical maps of mice given a particular drug, and the colors represent volumes, areas of where volumes have changed. And what was found was that the most volume changes occurred with mice treated with vincristine, which we'll abbreviate as VCR, followed by doxorubicin, abbreviated as DXR. As we see lots of blue, meaning representing volume loss. And these changes were also most similar to what we see in the ALL cancer survivors. So with doxorubicin and vincristine causing the most brain volume deficits, we now ask the question, what is the mechanism by which vincristine and doxorubicin reduce brain volume? And this is important to know because if we can identify mechanisms, then perhaps we can have a better idea to how we can modify current regimens to minimize brain toxicity. And what's very interesting is that neither of these drugs cross the blood-brain barrier. So we have to propose some indirect mechanisms that are responsible for brain toxicity. And so what are some of the proposed indirect mechanisms? Well, there's a growing body of literature suggesting immune alterations, specifically cytokine level changes that are driving these deficits. And to pitch this to you, first, we observe elevated cytokine levels in ALL cancer survivors years after treatment. So we can speculate that chemotherapy has a significant effect on the immune system. Secondly, we know that from mouse models, vincristine and doxorubicin can elevate pro-inflammatory cytokines, which have been attributed to their side effects. For example, in this paper, IL-1 beta mice knockouts were resistant to peripheral neuropathy caused by vincristine. And in this other paper, TNF-alpha knockouts mitigated damage to the muscle tissue caused by doxorubicin. And thirdly, this cytokine hypothesis is the leading proposed mechanism for cognitive deficits in adult patients, most notably breast cancer patients that report this cognitive deficit shortly after starting chemotherapy treatment. And to elaborate on how cytokines might affect the brain, here's a little schematic. So after being treated with chemotherapy, there's systemic inflammation where pro-inflammatory cytokines are elevated in the bloodstream. These cytokines can then make their way to the brain. And while the drugs themselves don't cross the blood-brain barrier, some cytokines can. And once they do, they can cause an immune response and activate microglia, causing a cascade of neuroinflammation. And so cytokines can represent a possible mechanism for brain toxicity. And so based on the progress I have so far, I'll be presenting today two aims. So aim one, I'll be determining which cytokine levels have been altered. And this can be a bit tricky since we can evaluate cytokines at different time points. And so we've opted for measuring both early cytokine levels around 24 hours post-treatment and relatively later cytokine levels a few days after treatment. For aim two, we also wanted to characterize this brain toxicity in young mice to pinpoint exactly when do these deficits in the brain start to manifest themselves. And to summarize this all into an experimental timeline, we had this first cohort where the mice are intravenously injected with chemotherapy or saline at postnatal day 17 and 19, and these represent the human equivalent time points. And then we sacrificed the mice at P20, so 24 hours later for early cytokine measurements. For cohort two, we repeat the same treatment paradigm, but we add on a few things. We use MRI to scan at P14 and at P23, so we can measure brain volume before and after treatment. And then we sacrifice the mice at P23 immediately after scanning for late cytokine measurements. And for our treatment groups, we have 1 saline, 2 doxorubicin, and 3 vincristine. To elaborate a bit more on my methodology, to measure cytokines, we use Luminex XMAP technology, which enables us to screen for 25 different cytokines simultaneously, including important pro-inflammatory ones such as TNF-alpha, IL-6, CCL2, and IL-1 beta. And to evaluate the cytokine concentrations, we use a linear mixed effects model to look at the effect of treatments with the litter as the random effects. For our in vivo mice MRI, we'll be using manganese-enhanced MRI with a T1 weighted gradient echo sequence. And once we have the images, we send them off to an automated pipeline for registration, which can segment the volumes of each structure in every image. And to analyze the volumes, we use once again a linear mixed effects model. So moving on to my results, I'll be presenting first early cytokine levels 24 hours after treatment. So here I'm showing several cytokines that were notably altered for doxorubicin-treated mice. And we see elevations in the cytokines GCSF, IP10, as well as everyone's favorite IL-6, which is one of the 4 cytokines that we anticipated to be elevated. We also see some decreases in IL-13, which is an anti-inflammatory cytokine. So from this, we can conclude that doxorubicin showed an early inflammation as well as dampened anti-inflammatory response. So moving on to vincristine, for vincristine, we get both increases and decreases. We have elevations in IL-1 beta, which is interesting because IL-1 beta was actually shown to drive some of vincristine's side effects. But we also see a decrease in MIP-1 beta, which is a chemokine as well. Interestingly, we see an increase and decrease in IL-4 and IL-13 respectively, which are both anti-inflammatory cytokines. And so with cytokine levels showing early alterations, we wonder what relatively later cytokines might show. So again, for doxorubicin, we see elevations in pro-inflammatory cytokines, IL-17, MIP-2, and once again, IP-10. And for vincristine, it was also very interesting. Basically, many cytokines across the board were lower for vincristine. I can point out MCP1 or TNF-alpha, which are commonly reported pro-inflammatory cytokines that we were expect to be elevated. We also see IL-10, which is an anti-inflammatory cytokine, to be decreased as well. And since cytokine concentrations seem to have been dampened all around, this might have been attributed to some immunosuppressive effects, which is a possibility since vincristine has been used as an immunosuppressive drug to treat some diseases. And to briefly summarize these cytokine results, from my cytokine screen, we see altered cytokines at both early and late time points, and that doxorubicin and vincristine do different things to the immune system. Doxorubicin tended to induce consistent inflammation, whereas vincristine caused some inflammation, but also some immune suppression. So moving on to my imaging results. So here I've plotted volumetric changes onto these neuroanatomical mappings. And I've taken coronal slices of the mouse brain, and the blue gradient represents percent changes in regions that are statistically significant after FDR correction. So the first cell here represents the controls, which is just there for reference. And if we go to the right, we see doxorubicin and vincristine, and that we see lots of blue, meaning widespread volume loss throughout the brain. And while the structures affected are consistent with the previous study, it's interesting to see that these changes already manifest themselves just days after treatment, meaning that we might want to mitigate these deficits sooner rather than later. Furthermore, I've plotted the volumes at P23 for the hippocampus and the pituitary gland. And we see that both of these chemotherapy agents seem to reduce the hippocampal volume, which is interesting since hippocampus is responsible for consolidating memory. We also see drastic volume decreases in the pituitary gland for both agents, and this might have significant implications since the pituitary gland is responsible for secreting important hormones. It can also hint at changes to the endocrine system, which itself can interact with the immune system and the brain. All right, so to finally summarize all my results, my cytokine measurements showed inflammation for doxorubicin for both early and late time points. Vincristine was also quite interesting as it appeared to get a mix of inflammation and immunosuppression. And we also found hits in IL-6 and IL-1 beta, which are among the pro-inflammatory cytokines often discussed in literature to cause downstream inflammation. Our neuroimaging results indicated that vincristine and doxorubicin caused widespread volume loss, which was consistent with a previous study. But adding on to that, we were able to pinpoint that these changes manifest themselves as early as 4 days after treatment. We were also able to show key structures being affected, including the hippocampus and the pituitary gland. And for future work, knowing that specific cytokines are indeed altered for doxorubicin after doxorubicin vincristine treatment, we want to see whether these cytokines are responsible for observed brain deficits. And we can evaluate this in the future using cytokine knockout mice, such as IL-6 or IL-1 beta knockouts, to see if these mice can show better brain structure outcome. So that concludes my presentation. I'd like to thank my supervisor, Dr. Brian Nyman, my lab colleagues at MICE, and my supervisor committee. If you want to contact me for future discussion, here's my email, which is just jonas.yeung@sickkids.ca. So thank you all for listening.
Thank you so much, Jonas. That was a really lovely talk. Super interesting work and nice to see a different angle coming from the cancer side of things, I guess. And we can open up the floor for a couple of questions. We have time, and maybe I'll just get the ball rolling. I guess I have a couple of questions. So first is pertaining to the future work you proposed here, conducting this work in a cytokine knockout mouse. Do you think that removing the cytokines would interfere with the potency of the drug, in a greater context, would interfere with its ability to actually perform well as a chemotherapy drug?
That could be possible. I think that doxorubicin specifically has some other mechanisms besides the anti-cancer mechanism. The anti-cancer mechanism itself, I don't believe are directly related to these cytokines. So we're not worried about that. But in context of my project, knocking out IL-6 is interesting. We're not so interested in the anti-cancer mechanism, but rather some of the side effects caused by these drugs. And so that's the rationale behind knocking out IL-6. Now, knocking out IL-6 can cause other issues, such as maybe developmental issues, but at the same time, we're working with controls. And so we're more or less trying to account for that acute inflammation and seeing whether knocking out IL-6 might mitigate that.
Awesome, great. Thank you. I see Lonnie has a question.
Always. That was really, really interesting. It's a very creative work that I haven't thought about before. So I guess in the human research especially, how does a researcher differentiate the impact of the children surviving cancer from the impact of the surviving the chemotherapy itself? And then do you think that, obviously you can experimentally address that in your work, but do you think that there could be any sort of interaction there that ought to be accounted for somehow?
Yeah, so I guess that's a question that we get asked frequently, is how does the cancer also affect brain development? And we know that cancer does affect brain development. I think one of the examples I mentioned when I was showing the 3 different studies was that breast cancer patients, so this is not the same, of course, but breast cancer patients reported, some brain fog or cognitive deficits soon after starting chemotherapy treatment. So that's, probably well after the cancer has manifested itself. And so at least that was one, maybe more or less anecdotal measurement of how they were able to parse out the cancer with the chemotherapy. Now, as you mentioned, there are mouse models that have worked on separate, having the cancer, having the chemotherapy, then combining them. And they see that, yes, the cancer and chemotherapy have isolated effects. And as you would probably expect, there's likely interaction or synergistic effects with it too. But we could change, we can't really do much about the cancer, but we could do something with the chemotherapy. And so that's the scope of the problem that we're addressing.